morning, everyone, and welcome to the first 2023 workshop of the Roundtable on Population Health Improvement, Shifting the Nation's Health Investments to Support Long, Healthy Lives for All, a participatory symposium. What that means is that the longest you'll have to sit and listen to anybody is right now during my introductory remarks, and after that, we hope to have a very interactive day and a half with the distinguished group we have here, both in the room and virtually. I'm Ray Baxter. I am the chair-elect of the Blue Shield of California Foundation and the secretary of the board of the CDC Foundation. I'm one of two co-chairs of the Roundtable, which is an activity of the Health and Medicine Division of the National Academies of Sciences, Engineering, and Medicine. Anna Diaz-Rue, our other co-chair, is unable to join us today, so I will both open and close the symposium. Let me particularly welcome our virtual as well as our in-person audience. As we begin, I do want to acknowledge that we are on the land of the Nacotchtank and Piscataway peoples, elders and ancestors, past, present, and future. Everywhere in the United States where participants find themselves at this moment, they are on the lands of Native American tribes and peoples. So we lift up with respect and gratitude all of the ancestors who have struggled for justice. In their memory, we seek to help build a just future by centering health equity as the prerequisite to improving population health. Our roundtable recognizes that health and quality of life for all are shaped by interdependent historical and contemporary social, political, economic, environmental, genetic, behavioral, and healthcare factors. Therefore, the Roundtable seeks to provoke and catalyze urgently needed multi-sector, community-engaged, collaborative action. One way we do this is by hosting several public workshops each year that bring together different perspectives and disciplines and sectors to explore and share what works to improve the conditions for equitable health and well-being in our communities in the United States. A few words about the context for this particular workshop, which is taking place at a noteworthy time. We are marking 1 decade since the Roundtable's launch, and 1 decade since two important National Academies reports called attention to several troubling and interconnected facts: that our nation falls far short of its potential in health, that we invest more in healthcare than peer nations, that our policies and investments do not prioritize health and well-being as opposed to medical treatment, and that most of the public is unaware of what we lose as a consequence, as a nation, as communities, as families and individuals. Today, we will touch only briefly on those disturbing facts and figures, which by now are familiar to most of us here. If you have not already, I suggest you take a look and ground yourself in your participant materials. There's a great video by Victor Zhao, president of the National Academy of Medicine, and there is an outstanding recent overview of the problem by our own Asia Coltrane of the Roundtable staff. The participant materials, if you haven't looked at them, are available on the event page. There's also a QR code outside that you can use to access those. Our more extensive exploration and dialogue here today will center on making the case, highlighting and discussing solutions, and reflecting on the path forward. In our opening keynote session, Dr. T, whom I want to welcome as the newest member of the Roundtable, Anita and Dave will offer their perspectives on how we can push beyond our prevailing assumptions about what it takes to make this a healthier nation. They will share stories and touch points that we will return to throughout the event. In recent years, some frameworks and concepts have emerged that hint at the path forward in improving health, equity, and well-being. I'll just mention two to get us started, both highlighted in your background materials. One is the notion of the 7 vital conditions for health and well-being, which were part of the 2021 Surgeon General's report on community health and economic prosperity. They're also part of the 2023 Federal Interagency Plan for Equitable Long-Term Recovery and Resilience. Another is the concept of anchor institutions and what it means for a hospital or a business or other organization to be an anchor and an authentic partner in the community they are serving. Both of these frameworks acknowledge complexity and interconnectedness. A kindergartner's lifespan is being shaped by early childhood experiences and exposures. And a patient who comes in for high blood pressure may live in a broader context of housing insecurity, limited meaningful social connections, juggling 2 or more jobs with minimal benefits and low pay. Both are shaped by history and by structural factors. Even our best intentioned institutions, systems, and policies have often not served all of us well, but we can learn and build from them. Today, we will explore examples of recent policies and programs that have, in fact, demonstrated impact or real promise. Today's workshop was organized by the following experts: Hilary Heischman of the Robert Wood Johnson Foundation, who chaired the planning committee, Marcella Alsan from Harvard University, Anita Chandra from RAND, Atul Grover from AAMC, Dora Hughes from CMS, Tiffany Manuel, The Case Made, Mac McCullough from Boise State University, Bobby Milstein from Rethink Health, Kara Odom Walker Nemours, and Tyler Norris with the Federal Reserve Bank of New York. The planning group staff work was supported by the National Academies staff, as always: Aisha Coltrane, Maggie Anderson, Ali Andrada, and Alina Bashu. Bios for all of our presenters are available in your attendee packet, along with the other background materials I mentioned earlier. And if you are tweeting during this event, please use the hashtag @PopHealthRT. Video recordings of the event will be posted on the webpage in about 1 week. One more note. Before COVID, our workshops were primarily in person. That enabled us to be interactive with each other and with our audiences. During COVID, we've been entirely or largely virtual, and it has been difficult to be participatory. Now we find ourselves in a hybrid world, seeking ways to recapture the interaction and collegiality that was a highlight of our roundtable. So today we have with us 3 facilitators who will help us make this event more participatory. We know you all bring ideas, experience, evidence, best practices, and solutions from your work, and we want to hear from you throughout this day and a half. James Whitfield and Kristen Whitfield of Be Change will facilitate our in-room, in-person interactions, and Fisher Kwa will facilitate the interactions with and among our virtual audience. So let me now turn to James Whitfield, who will give us a process overview of the agenda. James, thank you for being with us today.
Absolutely. Thank you, Ray. I don't know if you all are typically an applause group, but I think maybe we could give Ray a round of applause, if not for what he said, for certainly chairing the roundtable. I am James Whitfield. My wife and I are co-founders of a consultancy called Be Culture. We are working here with Fisher Kwa. Fisher and I know one another because we worked at a statewide health foundation based in Seattle, also known as the Wetter Washington, like that other Washington over there. And also spent a little time working at the U.S. Department of Health and Human Services in the Secretary's office. So it's good to be back among my roots. I used to work out of the HHS building, and I have been driving around all the time that we've been here. I haven't been here for 15 years, and I still haven't found it yet. Like, I know where it is on a map, but I still haven't gotten back, which kind of makes me feel good. My job today is to invite us into participation. So while I will be briefly introducing the people who are speaking to you, I am mainly introducing you to one another. The thing about today is that it's going to be participatory. So for those in the room, when you walked in, you noticed you're sort of facing one another. It's a round table, right? Like, so the idea of evoking being around a table, being able to see one another, while potentially a little on the nose, is definitely what we're trying to do, right? We want to make sure that you can see and talk to one another. Having done enough work in DC, I do know that there are times when the people out there are talking to the people up here, and the people up here are sort of listening or not listening, and they're going to make their own decisions. That's not today. Like, I get that that's a thing, but that's not today. Today, what we're doing is we're engaging with one another to figure out what we collectively want to do differently. So that means a few things. One is we're going to take an assets-based and appreciative inquiry approach, meaning there's lots of time we could spend on problems. However, we also are going to turn our attention pretty quickly to, so then what do we do next? What have we learned? What could we apply? What do we have at our disposal to make things be different into the future? It also means we have to figure out how to do that well with one another. So one of the things we're going to do is we want to lean into an approach that our company uses. Again, we're called Be Culture because we help people be the culture they wish to see. And it turns out that we create culture together. And the way that we do that is we set our expectations, our patterns of behavior. We can do that really intentionally. And there's one way to do that we call hosting. It means that we're all hosts of the space. Like, I'm a host, but don't just rely on me. Like, if you've ever been to a party, you know that the person throwing the party has a big effect on the party. However, it's really the other people at the party that determine whether or not it was a good party. And so we want all of you to help make this a good party. And the way we're going to do that is through hosting. And so it's our collaborative commitment to building an equitable, thriving growth environment. Like, that's what we're up to today. So it needs to be collaborative. Like, we need to do it together, and it needs to be a commitment. We have to make a choice. It's developmental. We're going to build it over time together, starting this morning, into the afternoon, into tomorrow. And we're trying to make sure that it is an equitable environment, meaning that we all get to engage in ways that's unique to us, that we can bring our unique contributions, and thriving, where we can actually grow up, become what we want to be in this environment. So that's what we're inviting you to do. And we use the acronym HOST as a way of reminding ourselves of the core principles of hosting. Now, what I want to say about this is, this comes from the literature. Like, when you look at sociology, anthropology, management theory, it really comes down to these four things that creates the kind of environments where people learn and grow effectively together. Like, if you want to be a good team, if you do these four things, that'll happen. So the first is honorable collaboration. So differences are appreciated and built upon for collective progress. You'll notice it doesn't say differences are tolerated. It means we're going to actually appreciate the fact that people are bringing different things into the conversation. The O stands for openness to learning and adaptation. This is where we're going to prioritize collectively learning from and with one another to find new ways of being and new ways of doing. Now, this is actually one of the places that's a little tough and different. All of you have expertise in some things. Some of those things are things you learned out of books. Some of those things are things you experienced throughout your life. And the tendency is to show up in places and be a little bit adversarial. My expertise, let me show you how my expertise trumps your expertise. As opposed to, no, you have expertise and I have expertise. We need to be open to learning from one another and then figuring out what do we do next given the reality that we're both bringing different expertise to the table. The S, then, when you do those first two things, you can have shared accountability. So we collectively own our successes, our challenges, and our learnings. So if we do the first two well, like if we honor one another, if we're open to learning, then we can share the responsibility of figuring out what to do next. And then we want to do all that in the context of the T, which is tending to our relationships. So we actively build and deepen trusting relationships as we work together. We want to walk out of here more bonded. In the heat of any dialogue, we want to make sure we're doing that in a way where we remember our humanity. And that we're trying to figure out how we do this in a way that when we walk out, we are better equipped to make change in our communities. and are more willing to pick up a phone or send a text to that person to figure out how we can work together to make that happen. So that's hosting. It's our collaborative commitment to building an equitable, thriving growth environment, honorable collaboration, openness to learning and adaptation, shared accountability, and tending to relationships. Those are going to be our operating procedures, sort of our ground rules for our time together today. So I don't know if I'm supposed to be in the shot or
Sit next to it.
not in the shot. Okay, all right. So those are going to be our ground rules. So I'm going to ask the folks in the room to either give a thumbs up, yes, that's a thing that we can do, or raise a hand if you have questions about what needs to be true in order to make that happen. So thumbs up, are we good? All right. And online, please know, like we're coming for you too. So this is also going to be a collaborative experience for you as well. And we're going to work really hard to make sure that those experiences that are happening online and in the room have some overlap, even though we know that primarily the conversations here are going to be happening in this space. And then those conversations are going to be happening in that space. We're working on that hybrid thing that Ray talked about. The last thing I want to say before I bring up our keynoters, in fact, maybe they can start making themselves to the front of the room. So I need Dr. T and Anita and Dave. You can just sort of find your way here. Is I want to remind us of our takeaways for today. So our goals for today are innovative ideas and also context for taking action. So we want you to both have cool and new and interesting ideas. We also, though, want to make sure that you walk out of here feeling like you have good next steps for what you can do with those ideas. So throughout our time today, that's where we're going to be focused on. I invite you to push really hard in order to find those things. We love, from an openness to learning and adaptation standpoint, we love differences of perspective. So when you're in your small groups or when we're having conversations collectively, we want to make sure that you bring those differences. We're going to invite our speakers and panelists when they're in the small group conversations to really push. Sometimes we ask for the panelists to sort of sit back. This time we're not. Like, let's engage, let's push, let's work with one another in order to figure out where we can go next.